Good afternoon, everyone. Welcome to our LAMP webinars. As usual, we will start off with blood or shui. Topic is purple tongue. In general, it takes a long time for a tongue to become purple, and therefore, when we see a purple tongue, it indicates a chronic condition. The only two exceptions are trauma and surgery, after which the tongue becomes purple in just a matter of days or hours. The purple color is not always obvious because it is often quite subtle. No? As a rule of thumb, if a tongue is not of a normal color, not pale nor red, the chances are that it might be subtly purple. It is important to be able to recognize a purple color because this is clinically very significant. A purple color always indicates blood stasis, and this can potentially cause serious diseases. For example, coronary heart disease, cancer, stroke. Tongue diagnosis allows us not only to diagnose pathology, but also to assess degree of severity of the pathology. So in the case of a purple tongue, it allows us not only to diagnose blood stasis, but also to ascertain its degree of severity. For example, a tongue may be only slightly purple, so this means that the blood stasis is mild. If a tongue is deeply purple, so the blood stasis is severe. So here we have two pictures of a purple tongue. The one on the left is very slightly purple, and it is more on the left side. No? Okay, on the one on the right, severely purple tongue, more on the right. So if the tongue is not of a normal color, it could be purple. And there are only three things that we have to consider: coronary heart disease, cancer, or stroke. Okay. There are two pathological purple colors: bluish purple and reddish color. Bluish purple, the blood stasis is associated with cold and yang deficiency, and the reddish purple tongue is associated with heat. So the bluish purple tongue develops from a pale tongue, while the reddish purple tongue develops from a red tongue. So the blood stasis is brought about by yang deficiency cold. This is where we see a tongue that is pale because cold congeals blood. Okay? And heat causes a red tongue because heat condenses blood. So here we have a severely bluish purple tongue, more on the left side. And this is a patient who had a large myoma. Okay. So thank you very much, everyone. Next, we go to tongue diagnosis. Let's welcome Ma'am Teresita Sumile from Rizal. Good afternoon, Ma'am Teresita.
Good afternoon po, Dr. Hector and classmates. Welcome to tongue diagnosis. Parang...
Yeah, sorry about that.
Okay lang po, Doc. Now let's talk about characteristics of yin deficient tongues, part 2. We have a patient, female, 38 years old. Tongue description: red points at the sides, dry, rough coating. Symptoms: shortened menstrual cycle, extremely profuse menstrual bleeding, very red menstrual blood, hot flashes, and irritability before the onset of menstruation. Western diagnosis, primary infertility. Background to disease, unhappy marriage, frustration, suppressed anger, and excessive intake of coffee. TCM diagnosis, we have kidney deficiency, hits in the liver, and injury to the fluids due to heat. Next patient is a female, 34 years old. Tongue description, red, thin, cracked, coating without root. Symptoms, severe exhaustion, inner restlessness, sore throat, numbness of the left thigh, frequent dizzy spells, and occasional night sweats. Western diagnoses are multiple sclerosis, chronic tonsillitis, blindness due to optic nerve atrophy of the left eye. Background to disease, irregular eating habits, frequent bouts of influenza, and long-standing emotional problems. TCM diagnosis, blood and kidney deficiency, and stomach and kidney deficiency. Okay. Next is a male, 38 years old. Tongue description is red, slightly thin. It has crack and has coating without root with red teeth. Symptoms, severe exhaustion, depression, lacking self-worth, night sweats, and sore throat. Western diagnosis, chronic tonsillitis. Background to disease, long-standing emotional problems since childhood, suppressed anger, and overwork. TCM diagnosis, kidney deficiency, fluids and kidney deficiency, and has heat in the liver. Heat in the heart. Next is female, 40 years old. Tongue description, deep red and has no coating. Symptoms, severe, long-lasting menstrual bleeding, dark red, strong-smelling menstrual blood, insomnia, and inner restlessness. Western diagnosis is none. Background to disease, deep frustration with life, and excessive consumption of meat and spicy fried foods. TCM diagnosis, kidney deficiency and heat in the blood, and she has also fluid deficiency. Yun lang po. Thank you so much for listening.
Thank you very much, Ma'am Teresita. Next, we have diagnosis by interrogation. Let's welcome Ma'am Vina Pasqua of Baguio. Good afternoon, Ma'am Vina.
Good afternoon po, Doctor. Good afternoon po sa lahat. So, sexual symptoms po tayo. And again, why we asked. An inquiry about the sexual life of the patient should always form part sa pagtatanong. This is not one of the traditional 10 questions from Chinese books, partly for cultural reasons. In fact, starting from the Ming period, and especially during the Qing dynasty, Chinese medicine was heavily influenced by the prevalent Confucian morality, which condemn pag nagsasalita ka o nagdi-display ka of sexuality. So, bakit nga tayo nagtatanong? Questions about sexual symptoms are asked primarily to ascertain the state of the kidneys. In fact, a kidney deficiency, ito po yung basis ng maraming sexual symptoms such as impotence, premature ejaculation, and frigidity. Sa mga lalaki naman, apart from asking about any sexual problems such as impotence, importante po na ma-establish natin pag ito ba ay yung symptoms nila is aggravated by sexual activity or parang nakakaramdam sila ng sobrang pagkapagod after sexual activity. An aggravation of a symptom after sexual activity always indicates po na Qi deficiency, often of the kidneys. A kidney deficiency is also indicated pag yung lalaki po ay nakakaramdam ng pagod after sexual activity. And particularly, pag yung pagod na yon is accompanied by parang nahihilo sila, masakit ang likod, o kaya mahina yung tuhod at saka iba pa. However, it should not be forgotten na yung other organs play a role in the origin of sexual symptoms, and especially po yung liver at saka yung heart. Yung heart in particular plays an important role in sexual desire and in the achievement of normal erection. And then when we asked, so sabi po ng author, tinatanong daw po niya yung sexual symptoms pag yung patient ay nagpapakita na may maliwanag na kidney or heart deficiency pattern. So, tinatanong din niya yung sexual symptoms pag yung patient is clearly under emotional stress at nasususpitsahan niya na this may be due to sexual problems such as impotence in men, or sa babae naman, failure to achieve an orgasm. Then, punta tayo sa paano po tayo magtanong. For obvious reasons, yung practitioner po kailangan to be particularly tactful pag nagtatanong siya about sexual symptoms, especially pag yung practitioner and patient ay of the opposite sex. In some cases kasi, pag nararamdaman niya instinctively that the patient would not appreciate such question, hindi na daw niya tinatanong. So, an inquiry about sexual activity in men is important not only for diagnostic reasons, but also to be able to advise them kung paano yung appropriate levels of sexual activities according to Chinese medicine. There are significant differences between the sexual physiology of men and of women that are not often taken into account pag nag-a-advise ng patient about yung desirable frequency of sexual activity. The Chinese caution about excessive sexual activity is more relevant to men than to women. In fact, yung Changi, pakicheck po Doc, a direct manifestations of essence, ito yung Jing, is sperm in men and menstrual blood naman sa women. Quite simply because men lose sperm, but women do not obviously lose menstrual blood during intercourse. Sexual activity may potentially be weakening for men, pag palagi po, but not so much for women. The sexual problems and the clinical significance of men and women we'll discuss separately. Ito yung pag men, ito yung A, impotence, B, lack of libido, C, premature ejaculation, yung D, nocturnal emissions, ang E naman is tiredness and dizziness after ejaculation. So sa women, dalawa lang, lack of libido o kaya pagkatapos ng orgasm, masakit ang kanyang ulo. So yan lang po. Thank you, Doctor. Thank you sa lahat.
Thank you very much, Ma'am Vina. We next proceed to pulse diagnosis. We will discuss other pulse qualities. Let's start with wiry pulse. This is translated as bowstring or taut. This is a very common pulse quality, and when you have felt it a few times, you are never in doubt about it again. It is thin and hard and pushes into the fingers like a guitar string. This will be noticeable when you release the pressure and let your fingers move upwards from the deep level to the surface. It is as if the pulse is in a hurry to get back to the surface after it has been pressed down. The wiry pulse will most often be seen when there is liver imbalance. liver qi stagnation or ascending liver yang, and liver wind or liver fire. Wiry pulse can also arise when there is pain or blood stagnation and in phlegm conditions. Patterns of imbalance, liver imbalances, blood stagnation, phlegm, and pain. Typical combinations, wiry and rapid, qi or phlegm stagnation that generate heat, wiry and slow, cold stagnation in the liver channel, wiry and slippery phlegm. Tight pulse. This is also a hard pulse like the wiry pulse, but the pulse is wider and less springy. It feels like a rope that has been twisted and tightened, such as a tight rope. Tight pulse is seen when there is cold. The cold can be both in the exterior and in the interior. Depth of the pulse will be decisive. Tight pulse can also be experienced when there is pain. So the pattern of imbalance patterns are cold and pain. Combinations, tight and slow, cold. Tight and superficial, invasion of wind cold. Tight and deep, internal excess cold. Tight and slippery, cold and phlegm stagnation. Slippery pulse. Slippery pulse feels very smooth, like glass beads rolling in a bowl, or the sensation that is felt when you squeeze an almond that has been boiled and the skin slips off. It is also described as water droplets on a duck's back. Like the wiry pulse, this is easily recognized once you have felt it a few times. Women who are in the later stages of pregnancy should have slippery pulse. So this may present an opportunity to experience this pulse in practice. A normal pulse or pingmai should feel slightly slippery. This is due to the movement of blood through channels and vessels. It is part of the pulse's stomach quality. It indicates that there is sufficient blood, qi, and xinye, or body fluids, and that blood is flowing freely through the vessel system. The pulse should have an aspect of the slippery quality in the same way that the tongue should have a thin coating. A small amount is a healthy sign, but too much coating on the tongue or slipperiness in the pulse is a pathological sign. Heat can agitate blood. This will cause blood to flow faster through the vessels. Increased movement of blood will give the pulse a more slippery quality. So the pulse will be slippery and rapid. Slippery pulse is often an indication that there is dampness and phlegm in the body. Dampness and phlegm will mean that there is extra lubrication in the vessels, so blood flows more smoothly than usual. Food stagnation can also lead to dampness, phlegm, and heat, thereby making the pulse slippery. Patterns of imbalance, phlegm, dampness, food stagnation, heat, pregnancy. Typical combinations, slippery and superficial, wind damp or wind phlegm. Slippery and deep, food stagnation, phlegm or dampness in the interior. Slippery and rapid, phlegm heat or damp heat. Slippery and slow, damp cold or phlegm cold. Slippery and large, phlegm heat. Slippery and without strength, dampness or phlegm due to qi deficiency. Thank you very much. Next, we go to differential diagnosis, and let's listen to Ma'am Needs You, straight from Quezon. Good afternoon, Ma'am Needs.
Good afternoon, Doc Hector. Good afternoon, everyone. How's my audio, Doc?
Very clear po.
Thank you. So, welcome to our TCM Foundations number 199. Dito na tayo sa small intestine patterns, small intestine deficient and cold. Okay. Ang etiology po nito or causes yung excessive consumption of cold and raw foods, hindering the transformation function of the small intestine. Yung mga underlying and or accompanying pathology, spleen yang deficiency, kidney yang deficiency. Okay? Sign and symptoms, abdominal pain, desire for hot drinks and pressure on the abdomen or borigmai, diarrhea, pale, frequent inhibited urine, cold limbs. Okay? If you palpate the pulse, it is deep, weak, and slow. If you see the tongue, pale ang kulay with white coating. So, ang treatment principle ay warm and supplement the splenium, warm the small intestine, and dissipate cold. This inhibit the bladder. Okay? Acupuncture treatment points you are going to use Friend 6 with moxa supplements the yang, stomach 39 stops abdominal pain, bladder 20 supplements spleen chi, bladder 28 is inhibits the bladder, stomach 25 stops diarrhea and abdominal pain, stomach 36 supplements the spleen yang, use moxa, bladder 27 warms small intestine, and bladder 23 supplements the kidney. Okay? Technique with the ng needle ay needle with supplementation and moxa. Thank you very much everyone. Thank you po, Doc.
Thank you very much, Ma'am Needs. We go now to acupuncture patterns and practice. Let's welcome once again Ma'am Teresita Sule. Good afternoon, Ma'am Teresita.
Good afternoon ulit, Dr. Hector and classmates. Welcome to Acupuncture Patterns and Practice. Now let's talk about jaundice, part 2. Clinical manifestations. In the early stages of the illness, yellowing of the sclera may not be apparent. Instead, the illness may manifest such symptoms as chills and fever, anorexia, nausea or vomiting, abdominal distension, porphyrigmus or weakness in the limbs. Yellowing of the sclera then appears after 3 to 5 days, followed by yellowing of the skin and urine. In young jaundice, the yellow color is bright and fresh. There are also fever, thirst, a yellow and greasy tongue coating, and a taut and rapid pulse. In yin jaundice, the yellow color is gray or smoky. There are also lassitude, coldness with cold aversion, a white and greasy tongue coating, and a soft and even pulse. In acute jaundice, the yellow color appears rapidly and may deepen into an orange or a gold-like color. There may be accompanying high fever, severe thirst, and mental confusion or delirium. Key points of analysis. Jaundice type. Young jaundice tends to develop abruptly and has a short course. The color is usually a bright and fresh yellow, but may be orange. The illness is usually in acute condition and is mostly due to dampness heat. Young jaundice is a condition of heat and of disease evil strength. Yin jaundice tends to develop gradually and has a long course. The color is usually a gray or smoky yellow. The illness is usually chronic or even severe and is mostly due to gelling of cold dampness in the spleen and the stomach, leading to Qi deficiency. Yin jaundice is a condition of cold and of deficiency. Next is acute jaundice. It develops explosively with rapid onset and deepening of color. The illness is most due to dampness heat with accompanying noxious toxins. There may be accompanying symptoms of the nutritive and blood levels. Acute jaundice is a serious condition and requires great care in diagnosis and management. illness course. Gradual intensification of jaundice, especially when associated with lassitude and increasing anorexia, indicates exacerbation of the illness. Gradual lightening of jaundice, especially when associated with increasing appetite, indicates improvement and favorable prognosis. A dull and lusterless color accompanied by restlessness or coma, hematemesis, and epistaxis indicates deterioration and poor prognosis. If improperly or inadequately treated, yang jaundice may progress to yin jaundice. Conversely, yin jaundice may show symptoms of yang jaundice if the patient is invaded simultaneously by exogenous dampness or heat, resulting in a condition of mixed deficiency and strength. Now let's go to acupuncture treatment. In yang jaundice, choose bladder 19, liver 3, and stomach 44. Then use filiform needles and apply the reducing method. In yin jaundice, select bladder 19, bladder 20, and spleen 9 and spleen 6. Use filiform needles and apply the even method. Now let's go to case history. The patient was a 17-year-old male student who had abrupt onset of jaundice 5 days earlier. Its color was orange. He had dizziness, a bitter taste, reddish-yellow urine, dry feces, epigastric distension, nausea, anorexia, afternoon temperature of 37.2 to 37.6 degrees Celsius or 99 to 99.7 degrees Fahrenheit. In the afternoon, lassitude and somnolence. On examination, his general condition was fair. He had jaundice of the skin and sclera. The lung was clear on auscultation. The cardiac border was normal on percussion. The heart rate was 90 beats per minute with irregular rhythm. The liver was palpable at 2 cm below the rib margins and was tender to pressure. There was no edema. Neurological examination showed no abnormality. The tongue was plump with thick white and greasy coating. The pulse was slippery and rapid. Liver function tests were abnormal, showing the following: ALT 2615 U over I, AST 930 U over I, bilirubin 8.1 milligram, direct bilirubin 4.6 milligram, and anti-HA-IgM positive. He was diagnosed to have acute infectious hepatitis with jaundice. Now let's go to diagnosis. Jaundice of the yang type due to accumulated dampness heat, steaming the liver and the gallbladder, causing blockage and forcing bile to overflow and extravasate. Therapeutic principle: remove blockage, mobilize liver and gallbladder qi, cool heat, eliminate dampness, and detoxify poisons. Yun lang po. Thank you so much for listening.
Thank you very much, Ma'am Teresita. We will proceed to signs and symptoms. And let's call on Ma'am Vina once again for the presentation. Good afternoon, Ma'am Vina.
Good afternoon po, Doctor. Good afternoon po sa lahat. So, signs and symptoms po tayo, day 91, hot and painful eyes. Pag full po, liver fire. Hot and painful eyes, So ito yung nakikita, bloodshot eyes, sakit ang ulo, nahihilo, may tinnitus, may irritability, propensity to outburst of anger, pula po ang kanilang mukha. So nauuhaw at yung panlasa ay mapait. Constipation, dark urine, pula din po yung kanilang dila, pero mas pula sa sides. And dry yellow coating. At ang pulso po ay wiry rapid. Ang ginagamit po dito na acupuncture points ay liver 2, LI11 at saka LI4. Kasi nga po, fire yan. Heat. Next po ay heart fire, hot and painful eyes. Red eyes, redness of the inner canthus of the eyes, burning sensation in the eyes, palpitations, thirst, mouth and tongue ulcers. So ito yung nabibitak-bitak. Mental restlessness, feeling agitated, insomnia, dream disturbed sleep, feeling of heat. Pula ang kanilang dila din. At bitter taste. Red tongue with redder tip and yellow coating. Ang pulso po ay overflowing rapid. Ang acupuncture points na ginamit dito ay heart 8, LI11, LI4, at saka heart 5 po. Other patterns, pag liver yang rising naman, hot and painful eyes, a feeling of distension of the eyes, headache, dizziness, tinnitus, irritability, propensity to outburst of anger, and wiry pulse. Yan po yung liver yang rising. Pag liver wind naman, painful eyes, pero hindi naman necessary na mainit. May tremors, may severe, matindi po yung pagkahilo, tinnitus, headache, numbness of limbs, may tics, may stiff, deviated, may wind yun, or moving tongue, at wiry pulse. Then punta tayo sa damp heat in the head, hot and painful eyes. So sticky po yung eyelids. Heaviness of the eyelids, sticky taste, facial pain, a sticky yellow nasal discharge, a feeling of heaviness of the head. Thirst pero ayaw niya po, nauuhaw siya pero ayaw niya pong uminom. A feeling of heat, dull yellow complexion, sticky yellow tongue coating, slippery rapid pulse. So yan lang po. Thank you, Doctor. Thank you sa lahat ulit.
Thank you very much, Ma'am Vina. We will now proceed to the last presentation. We are starting on a new chapter, bleeding. We'll discuss the etiology of bleeding. External pathogenic factors. Wind heat, when particularly intense, may injure the lungs' blood connecting channels and cause bleeding either from the nose or with coughing. External damp heat may invade the intestines or bladder and injure the blood connecting channels there, leading to bleeding in the stools or urine. Another cause is irregular diet. Excessive consumption of hot foods or hot greasy foods and alcohol leads to heat or damp heat. Heat invades the blood portion and causes blood to push out of the vessels. This is bleeding from blood heat. Excessive consumption of greasy foods and dairy products may weaken the spleen. So deficient spleen qi may fail to hold blood in the vessels, leading to bleeding. So this is bleeding from qi deficiency. Emotional strain is an important cause of bleeding. So bawal na masyadong stress, no? Every emotion, when excessive and prolonged, impairs the proper movement of qi, and so this will lead to qi stagnation. Qi stagnation over a long period of time leads to fire. So fire enters the blood portion and makes the blood reckless, causing bleeding. Bleeding from emotional strain is associated with qi rebelling upward, such as in liver fire. The bleeding would occur upward, so there will be vomiting, coughing, or from the nose. In more severe cases, and in old people with a more complex pathology, this will lead to bleeding upward in the brain and cause cerebral hemorrhage. So bawal ma-stress, no? Another cause of bleeding is overwork. This is an extremely common cause, especially in chronic cases. Working long hours without adequate rest over many years weakens spleen qi and kidney yin. This may lead to bleeding in two different ways. Either deficient qi or yin may fail to hold blood and cause bleeding. Furthermore, yin deficiency over a long period of time leads to empty heat, which may agitate the blood and cause bleeding. Chronic illness and childbirth. A long chronic illness causes spleen deficiency, and this will cause bleeding. In women of weak body condition, childbirth may deplete the kidneys. This may cause bleeding from qi or yin deficiency or from empty heat. Aftermath of a heat disease. Wind heat has a strong tendency to cause internal dryness. As it dries up the body fluids, it may quickly turn also into interior heat. Heat may damage the blood connecting channels and cause bleeding, especially from the lungs, stomach, or intestines. Thank you very much. We may now, you may now write your questions on the chat box. So, yeah, if there are no questions, we would like to thank everyone for joining. And special thanks to our presenters. Thank you very much.
Thank you din po, Dr. Hector.
Thank you po.
Thank you po.
Pahinga muna, Marites. Okay.
Litis ulit tayo.